All right, I'd love to get started. It's nice to see you all again. So as a reminder, we're from the Office of Student Mental Health and Wellness. I'm Robin Hershkowitz. I'm the Senior Director of the office. And my partner, Mike, not on, is, go ahead.
I'm Amy Stern. I'm the Assistant Director of the office.
Okay, so new topic. Maybe we're continuing what we talked about last time. We're going to talk today about managing stress and anxiety. A couple of things I just want to make you aware of. We are recording the session, so you'll be able to go back to it, but we are not going to record you, meaning your faces aren't on this. We are going to stop recording before we get to the discussion part, but we really want to hear from you. So I hope this doesn't inhibit you from participating. If you do, we are glad to edit what you say out. So that's not a part of the formal recording. We have no disclosures or conflicts of interest. Anybody have any concerns about that before we go forward? Okay. All right. So here's our objectives. I'm just going to stand over here.
Okay.
So a couple of things that we hope you get out of this session, being able to identify the physical and emotional symptoms of anxiety. Consider which situations, places, people, thoughts bring on anxiety for you. We call those triggers. Learn and practice strategies. We're going to do that together to reduce anxiety and, of course, promote relaxation and stress reduction. And then finally, develop a plan to be able to manage anxiety before it happens, while it happens, and after it happens. We're going to talk a lot about that as we go forward. So let's just get your baseline. I'm going to ask you to rate your level of stress and anxiety using this very simple scale. You can keep it to yourself, but last time we met, we talked about taking your emotional temperature, right? Like an emotional thermometer. So we're going to use this just as a measurement. Okay, let's talk about anxiety.
All right. So besides the fact that we were asked to speak about anxiety by your faculty, why do you think we are here talking about anxiety? Anyone have any thoughts? Yes. It can inhibit your success in school.
Well
Absolutely. Well practiced. Yes. Yeah, it's very likely to happen, and kind of being aware of what triggers anxiety for you and how to manage it helps you be prepared. So this is why we're here talking about anxiety, because anxiety can be a very common and normal part of human existence. It's uncomfortable. We don't like it, but it's certainly not uncommon. Now we're going to talk later about the difference between kind of normal everyday anxiety and having an anxiety disorder, which are two separate things. But anxiety disorders, as you can see, are among the most commonly diagnosed mental health disorders in the United States. On average, about 26% of men and 40% of women will be diagnosed with an anxiety disorder during their lifetime.
Sorry, we wanted to ask you, does that surprise you? No.
No, it doesn't surprise you. And I imagine it's not all that surprising for you to see that during the pandemic, the COVID-19 pandemic, the numbers of anxiety and depression increased by 25%, which is a huge jump in numbers. And I suspect that doesn't really even capture everything that occurred, even in the past year. Right. So we're talking about anxiety because it is so prevalent, and because if you haven't encountered anxiety so far in your life, you very well may encounter it now and moving forward, and we want to help you feel prepared to cope with it.
Okay, so what is anxiety? Okay, we want to differentiate the definitions.
Okay. So when we talk about anxiety, we're talking about an emotion, right? That's characterized by apprehension and a somatic symptoms, physical symptoms of tension. in which one anticipates impending danger, catastrophe, or misfortune. Like that feeling of something bad is going to happen, right? And we compare that to fear, which we're going to define as an appropriate, present-oriented, and short-lived response to a clear, identifiable, and specific threat. All right. And that also, in turn, relates to stress. Stress is what we're going to call the external trigger, all right, or it's caused by an external trigger. And the trigger can also be short-term, such as an academic deadline or a fight with a loved one or something of that nature.
Right. So stress being something imposed upon us, anxiety being something that is actually we're experiencing. It's not right or wrong, that we just want to separate them because they also often become conflated.
Hi. Fight, flight, or freeze response. Has anyone heard of these terms? Yeah. So this, this has an evolutionary basis. Way back when, if we were about to be attacked by a saber-toothed tiger, we had a physiological response to help us stay safe. We froze, we fled, or we fought, okay? And in the face of a real external danger, this really serves us well. Even today, this serves us well when we are faced with a danger. We experience a stressful event, the amygdala, which is our emotion processing center, sends a distress signal to the hypothalamus. And then that communicates to the rest of the body that we need to have this fight, flight, or freeze response. The problem that we have now, though, in modern life, is that our body will have this response to events that are not catastrophic and that are not life-threatening. So you can be taking an exam or thinking about taking an exam and have the physiological response as if you were in a life-threatening situation. And so again, while physiologically this makes a lot of sense in terms of danger, it can be problematic when we have what we call these false alarms, when our body reacts as if we're in imminent danger, when in fact, it is not a life-threatening circumstance.
It's also really uncomfortable, right? Anxiety is really, really disabling and uncomfortable. So we're calling those false alarms, right? It's all that idea that this alarm system's going off, but you're not actually in danger and you're having trouble turning it off. So we want to make this very tangible and talk about thinking of anxiety both in the physical symptoms and the emotional symptoms, knowing that this is not an inclusive list, but gives you a broad sense of what this can feel like. And then I want to say this with a little asterisk, because certainly some of these can be explained by a medical condition. So with that said, if you're having some of these, please do get that checked out as well. But general physical symptoms of anxiety include aches and pains, so muscle aches, muscle tension, chest pain, or feeling like your heart is racing. If you've ever had the unfortunate experience of having a panic attack, it is really scary. And many people go to the emergency room because they think they're dying. Okay, so it can be really, really scary and uncomfortable. And I should say panic attack being the most severe expression of anxiety. Exhaustion or trouble sleeping, headaches, dizziness, or shaking. Many people describe anxiety as like a fog, but literally feeling dizzy. High blood pressure certainly can be a response to anxiety. Muscle tension, jaw tightening or clenching, and stomach or digestive problems, like stomach aches or other related symptoms. And then some emotional symptoms of anxiety. So feeling nervous, certainly worrying a lot, but nervousness and worry that are really difficult for you to control. This sense of restlessness or just being on edge, different from irritability, which I think is a really important indicator. Actually, we see irritability in depression and anxiety, even though it's not in the DSM diagnosis. It's a really strong indicator because it tells us also that our frustration tolerance is pretty low. So irritability, difficulty concentrating or paying attention. So of course, in an academic setting, this is something we really need to pay attention to because it also affects our ability to retain information and then to pull it forward as well. disturbed sleep, and certainly getting tired easily. That can be very exhausting. You're expending a lot of energy when we're experiencing anxiety. So is it useful? What do you think? Can anxiety, or let's say, can stress be useful? Yeah, how so? How do you think it could be useful? Yes. Right? Helps you complete your task, definitely. How else could it be helpful? Help you prioritize. Can even be so uncomfortable that it leads you to do something that you've been putting off or avoiding, right? Okay. So let's break it down a little bit more and dive a little bit deeper into anxiety.
Yeah, so to build on what you all said, which is accurate, is that there are times when anxiety can be extremely useful in the short term, right? So before today's presentation, Robin and I maybe were a little anxious, and we prepared.
Just a little.
Yeah, just a little bit. We didn't walk in here with no slides and no PowerPoint and no idea what we were talking about. That little bit of anxiety helped us create a presentation and prepare and be ready to speak to everyone today. So it can have a motivating aspect to it, a little bit of anxiety. And it also has the ability to keep us safe, right? So, if you feel a little anxious about riding a motorcycle, perhaps it'll lead you to take safety precautions when you're on the motorcycle, or not to drive a motorcycle at all. But
that's an interesting example.
I don't even know where I'm coming up with motorcycles. It's the first thing that came to mind. Maybe I should have prepared more.
But to that point, right, it's biological, right? So we don't want to get rid of anxiety. And we should say that part of our goal here is not to get rid of anxiety, but is to manage it, to understand it, and to be able to have control over it. But anxiety biologically is useful. It gives us information, but we're talking about those false alarms and the times where it's not. So long-term, chronic anxiety leads to this continued activation, this fight, flight, or freeze, the stress response, which causes wear and tear on the body. It can actually cause significant conditions, medical conditions. So it's not intended to be something we experience long-term. Therefore, the prolonged state of high alert and stress, not in the face of imminent danger, can be detrimental. There are places where people do live in that constant state of stress, and they can't mitigate it, but we're not focusing on that. But just understand the long-term impact of that. So this reaction is meant to be temporary. It's meant to be short-term, and under normal conditions, your body recovers and you move on. You don't stay in that heightened alert state all the time. So anxiety, therefore, becomes problematic when the stressors continue without relief, or you can't turn that alarm off. That makes sense so far? Okay, so we do want to distinguish, though, what we're talking about, again, more specifically between normal anxiety and what is actually an anxiety disorder. And I do want to say we're not defining each diagnostic criteria of anxiety disorders, but we want to really differentiate for you so you don't walk away saying, oh, I got an anxiety disorder. Okay, really, there's a difference here.
So you'll see under the column of normal anxiety, listen, it's very expected or normal to have occasional worry about events. Here's an exam coming up, or you have a breakup. These things make you upset, and you might experience some anxiety over them. And there's nothing pathological about that. Having some embarrassment or self-consciousness in the middle of a social situation, uncomfortable social situation, that's also a very normal time to have some anxiety. Jitters, dizziness, nerves, feeling a little sweaty during an exam. These are all typical times when people might experience anxiety. Again, wanting to make sure that you're in a healthy space, that your environment is safe, that anxiety helps you kind of monitor your surroundings and make sure that you're keeping yourself safe and out of harm's way. And of course, if you experience a traumatic event, having some anxiety following that event, as well as having perhaps some depression, that's a pretty normative reaction as well.
So most of the things that Amy is outlining for you are temporary, right? They're short-term, they remit. When we talk about anxieties, we're talking about something that's constant, something that's chronic, that really is around unsubstantiated worry that causes significant distress. It disturbs your social life. It interferes with your functioning. It interferes with your ability to do whatever it is you either need to do or want to do. So that's really where we've crossed into a different territory. When the anxiety is interfering with your ability to function. Okay, so we see this as avoidance of common social situations for fear of being judged, embarrassed. You're avoiding something. There's something you're just not doing. Certainly more significant repeated random panic attacks, persistent worry, the anticipation of another panic attack can also be very powerful and can cause you to change your behavior to avoid that. And then we're talking about irrational fear or avoidance of an object, a place, or person. These are things where you're experiencing, but the majority of people around you are not experiencing that same stimulus in the same way that you are, the same fear or avoidance that you're experiencing. Performing uncontrollable, repetitive actions such as washing your hands repeatedly or checking things over and over. The key word obviously being uncontrollable, something you're feeling compelled to do, unable to stop doing. Ongoing and reoccurring nightmares. These are invasive thoughts. These are things that are causing ruminations, flashbacks, emotional numbing or disassociation. These are things that do not fall in the continuum of normal anxiety. And that could be related to a traumatic event in your life that occurred present or several years ago or at any point. I want to just pause for a second. Do you have any questions or anything you want us to clarify between these two, what this concept that we're outlining? Okay, so it's just really important to distinguish. Okay, so how do you know? You know yourself, or we're going to help you better understand yourself. How do you know when you're feeling stressed or anxious? Anyone? Thank you. Your mind's racing, definitely, right? Racing thoughts. Thank you. Right? What just happened? You're in your own head, but you missed what's happening. You're not present. Sweaty,
Yeah.
definitely. Feeling agitated. Can't sit still. Yeah. Can't sleep. Overthinking. Yeah. Intrusive thoughts that keep you up, or trouble falling asleep or staying asleep. Go ahead. Regular things feel overwhelming. So like inaction or lack of motivation to do some things. Over here. Yeah. That's your whole day. Right. So listen to how exhausting this is, right? This does not feel good. Let's do something about it. So at the end, there is a QR code for you to scan for resources, and this sheet is in there. And so I encourage you to do a self-check about what we talked about, but to really understand this. And I also want to let you know, which you may already know, that your anxiety response is different in different situations. So maybe when I stand up and talk, I sweat. I don't, but maybe I do, right? But maybe in another situation, my anxiety response could look different. That's completely normal. So it's important to understand the situations in which they come up, what that looks like. And as we go forward, we're going to give you a number of different strategies and tools, because it's definitely not a one size fits all. But really take some time later, any point, to really kind of tune in and understand what this looks and feels like for you. Okay, managing this. Now we're going to get into it. So triggers. Triggers are these things that set off our anxiety, right? I was just giving you a couple examples. So it could be a person, it could be a situation, a social situation. For some people, it could be a movie, it can be a commercial. I've heard it in a number of different ways. What I want to tell you is that triggers are individualized. So you really, and I really want to encourage you to know yourself and understand how and when this comes up for you. And certainly we're talking about this in anticipation of you going into anatomy lab, but these strategies can be used at any point. But for some people, actually a lot of people, anatomy lab is a very significant trigger. So knowing your triggers can help you predict when you might feel anxious, and then also understand what is the associated physical or emotional response to that trigger. You with me? Okay. And then creating a plan. So we're going to talk about this quite a bit, because this idea is that it's really hard to make a plan to manage anxiety when you're anxious. It's really hard. You're just describing it. It's very hard to think straight. So we don't want to do that. We're in the middle of it, right? We want to think about just like sort of you practice a fire drill, right? Because in an actual fire, you're probably going to have a heightened emotion. You might be scared. That will affect your thinking. But if you practice it, you're on autopilot. You go, go, go. Anxiety is the same way. So we want to think about creating a plan for before we become anxious, what we're going to do when we're anxious in the specific situation. And then we can't forget, what are we going to do after? What are we going to do to take care of ourselves? Because that was really a lot of emotion. So we'll talk more about that. Okay.
So we're just going to stop for a moment and speak specifically about the experience of students going into a gross anatomy lab for the first time. There's a lot of literature written about this experience. And your faculty thought that this is something that might impact you. There's going to be a part 2 to this talk on anxiety in August.
August
15th.
August 15th at 5 o'clock.
Yeah.
And that's more specific to really death anxiety and what we call cadaver anxiety.
But since you are on the verge of having this experience, we wanted to talk a little bit about it now. So, I mean, overall, many students have a lot of anxiety or concern prior to starting dissection. But by and large, they find it to be a very useful and meaningful experience. But for a lot of people, this is the first experience with death. Death in a way that's up close, more intimate than even a funeral. And so it's understandable that there would be some concern or anxiety around this experience. A lot of students worry about the smell of the anatomy lab, or they worry about the experience of seeing the cadaver's face or hands. There's concern about fear of infection or of getting dizzy or lightheaded while you're in the lab doing the dissection, fear that maybe you're causing pain or harm to the cadaver, or wondering about the life of the cadaver. And so, what? Keep on. All right, so we'll revisit this, and keep this in mind as you enter your experience with anatomy lab. And then when we see each other again for part 2 of this in August, you can let us know what your experiences were like. Okay.
Right. So we are encouraging you to think about what that might be like for you. So sometimes we think, I don't really want to think about that, but it's actually really helpful to think about it, because you can anticipate, you can start to figure out what you need, which could be anything from information to just figure out how you're going to navigate it. But think about it now. So think about what it might be like. And then we hope that you'll continue this conversation with us and come back and tell us, what was it actually like? Or you gave some thought to it, and here's the thing that you're really worried or concerned about. So we'll have another opportunity to discuss it in depth.
And we're going to be talking about a variety of different anxiety management skills, like coping strategies. And we'll give you an example of how these can be put into place as it applies to your experience in anatomy lab, as well as to any number of experiences that you may have that are triggering anxiety for you.
Okay. So we gave you all this information. You have a good sense of it. And of course, now what? Now, what are you going to do? And we know from talking to this group that many of you have some really good strategies in place already, but we want to build on them a little bit. So last time we met, I talked about behavioral strategies and relaxation strategies. So relaxation strategies and behavioral strategies are a way to address the physiological response, right? The physical response that we have to stress and anxiety. We did belly breathing, right? Last time we met. And just as a reminder, behavioral activation or behavioral strategies are a part of cognitive behavioral therapy, and then look very much just like everyday things that you're probably doing, whether it's meditation, breathing exercises. Today, we're going to try some guided imagery together. Also, another example is muscle relaxation or progressive muscle relaxation. And if I didn't say this before, or even if I did, I'm going to say it again. So a lot of these require trial and error, meaning, okay, I tried meditation. I really didn't like it. Okay. Did you try it with another person? So anybody use Headspace? Okay. Me too. But do you like Kasanga? Do you like Andy? Like, who's your person, right? It takes a while to figure out who your person is, or maybe you use a different. So before we say, well, that just doesn't work for me, keep trying until you find the right one. And sometimes you might only be able to try breathing or meditation for 1 minute, and then you build up. It doesn't matter what it is. The idea is to try it and know that it's trial and error, and that you really need a toolbox of strategies. So something you may use in one situation may stop working, or may not work as effectively. That doesn't mean we say, okay, this doesn't work, but it does mean we can't have one or two. We really need a toolbox of things, and we need to, again, practice them. It's this idea of practicing something when we are not anxious in a neutral state allows us to call it forward when we really need it, when we are anxious. But we have to first learn it. It's a new skill. It's a new behavior. It seems like it's really easy to just sit quietly and breathe. It's not so easy. So we have to find something that really works for us. Thoughts on that? No? Okay. You want to try some new stuff? I love the enthusiasm. Woo-hoo! Thank you.
All right. So do you remember last week we did diaphragmatic breathing, belly breathing, where you had one hand on your chest, one hand on your belly. Where there are a whole slew of different kinds of breathing exercises out there, but here's another one called box breathing or square breathing. And it is you breathe into the count of 4, hold for a count of 4, exhale for a count of 4, and then hold again for a count of 4. And we'll try this together. But you'll see on the side here, what is the impact on your anxiety? So we like people to check in. So we're asking you, check in now, see where your anxiety level is. We'll do a few rounds of the breathing, and then you can assess, did it have an impact on my anxiety? Did the breathing exercise make your anxiety worse? Did it have no effect at all? Or did it decrease your anxiety? And this is something, a template you can use to kind of measure the efficacy of the different relaxation exercises that you try. Okay, so ready? And we're gonna breathe, start with an inhale. Breathe in, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4. Inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4. One more. Inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4.
How does this one compare for you in terms of what it feels like to the belly breathing we did the other day? Increase,
Yeah.
decrease, neutral.
Oh, yeah?
The pauses help clear the mind. The rhythmic sort of counting of the breathing can be really useful. No, you're shaking your head. You didn't like it. Okay,
No.
great. So you proved my point. Thank you. Trial and error. You have to
Mhm.
find the one that works for you, but it does sometimes take exploring different types of breathing exercises. Sure, go ahead. Mm-hmm. Mm-hmm. Did it work for you? Then that's what matters.
Right.
Yeah. There's also pursed lip breathing, which is like there's different ways to sort of get there. And it also depends on, how active your mind is and what else you need to do to be able to really be present. Go ahead. Thank you for that.
Mhm.
Absolutely. Yeah. So if you really meditate or doing these breathing exercises, for those of you who do, that's why they give you a blanket at the end of yoga, because you're bringing your core body temperature down, right? You have relaxed, and it does feel differently. You have a lot of control over the body, actually. Yeah. Thank you for that reminder. Anybody else? Yeah. Similar, because we're still breathing, right? But it is a different way of doing it. And so I think what we want to impart to you is give you several tools in that toolbox, and then really try the ones that feel right for you. At some point, you will need these, whether it's in the lab or not. And we want you to sort of think about, again, how this relates to you and give you options on different things you can try. But it is very similar. We're still breathing, but differently. Yeah. Okay. So we'd like to introduce you, though, to guided imagery. How many of you have tried guided imagery? Great. So I'm a big fan of guided imagery. What does this mean? This is something where we take our mind to a different place and we really tap into using our senses to create an image of something that should be either a happy place or a neutral place. People can use a guided imagery, which I'll take you through, and certainly this website, Inner Health Studio, has some good things. Sometimes people use a picture or a memory, a vacation, or maybe just imagining being with somebody that they really enjoy being with. The idea, though, is that guided imagery helps people relax by just focusing the mind and taking us someplace else. It's like a mental vacation. And you focus on an object or a place instead of thinking about the current situation, the hassle you're having, or whatever the situation is. It's really helpful for people who have racing thoughts or intrusive thoughts. It's particularly helpful for people who have difficulty falling asleep or staying asleep, sort of getting the body to calm down. And when our mind is overworking, this can be really useful tool. And if you are able to really practice and hone this skill, you will experience that temporary type of relief. So I'm going to walk you through one. And I really encourage you to try this, allow yourself to try it. So I'm going to ask you to get as comfortable as you can in the chair and encourage you to put both feet on the ground. If you've got your computer or something, take a minute, put it down so you're not thinking about it. And just relax your body by releasing any areas of tension, allowing your arms and legs just to be loose and relaxed. Just again, try tapping into that breath, breathing in through the nose and out through your mouth. And just kind of feel your body giving up, giving way to the tension, just becoming relaxed. Understanding also that your mind will wander. It's completely normal. Just gently and kindly bring your mind back to the sound of my voice as we go forward. And just allow your body to rest really heavily on the surface where you're sitting. Imagine you are walking towards the ocean, walking through a beautiful tropical forest. You can hear the waves up ahead. You can smell the ocean spray. The air is warm. You feel a pleasant, cool breeze blowing through the trees. You walk along a path, coming closer to the sea. And as you come to the edge of the trees, you see the brilliant aqua color of the ocean ahead. You walk out of the forest and onto a long stretch of white sand. The sand is very soft, like powder. Imagine taking off your shoes and walking through the hot, white sand toward the water. The beach is wide and long. You hear the waves crashing to the shore. It's peaceful here. Smell the clean salt water and beach. You gaze again toward the water. It is a bright blue-green. See the waves crashing up onto the sand and receding back toward the ocean, washing up and floating back down. Enjoy the ever-repeating rhythm of the waves. Imagine yourself walking toward the water over the fine, hot sand. You are feeling very warm. Pay attention to what you smell, what you hear, and what you see. Maybe you hear birds in the background. It's a pleasant, soothing sound. Walk further into the clear, clean water. You can see the white sand under the water. The water is a pleasant, relaxing temperature, providing relief from the hot sun. The water is cool but not cold. You walk further into the water if you wish. Swim if you want. Enjoy the ocean for a few minutes. You feel more and more relaxed. Enjoy the ocean. Now you are feeling calm and refreshed. You walk back out of the water and onto the beach. Stroll along the beach at the water's edge, free of worries, calm. Up ahead is a comfortable lounge chair and towel, just for you. Sit or lie down in the chair, or spread the towel on the sand. Relax on the chair or towel, enjoying the warm sun, the breeze, the waves. You feel peaceful and relaxed. Allow your stresses to melt away. Hear the sounds and smells all around you. And when you are ready to return, do so slowly and gently, just bringing yourself back to your usual level of alertness and awareness, keeping with you the feeling of calm and relaxation, feeling ready to return to your day. And when you're ready, you can open your eyes, knowing that you can practice this visualization as often as you need or want to, and that it's there for you whenever you need it. What was that like for you? I put you all to sleep.
Yeah.
Thumbs up, thumbs down. Let's use the same scale, right? Like increase anxiety, decrease anxiety, neutral. How many of you felt increase in your anxiety? Decrease? Neutral. All right, tough one. All right. But see, you can take your mind anywhere you want to take it. And it doesn't have to be that long. It could be shorter. And it doesn't have to be the ocean. It could be anything that you want. But it's the idea that your mind is yours and you can have control over it when you need it. But really getting into those senses, right? We didn't even smell coconut oil or, suntan lotion or whatever else you might associate with the beach. So you can take it as far as you want to. Okay, so we did that. But again, this idea of like a check-in before and after. Okay, so now we're going to switch into grounding exercises. Amy's going to take us through that. How many of you have heard of grounding exercises? All right, a couple of you. Great.
So grounding exercises that are used quite commonly in treatment of people that have trauma, but they can also be very effective when you're feeling a lot of anxiety, when the intensity of your anxiety is intensifying, and you want to try to bring yourself back to the moment you're in, to your body, to your surroundings, as a way to kind of reassure your mind that you, in the present moment, you're not in danger. So you want to engage your five senses, right? And we're going to talk about, maybe you can just go to the next slide even. There are five senses to help you stay in the present in your body, right? So there's one grounding exercise that's actually called five senses. And so that involves you looking around the room when you're in the moment and identifying five things that you can see. And sometimes if there's a lot going on, maybe you make it more specific. It's five, blue things that you can see. And then you're going to pick four things that you can touch, three things that you can hear, two things that you can smell, one thing that you can taste. And the key to this is to really kind of get hyper-focused and attuned to the details as you are identifying these things that you're sensing. So when you look at something, notice the color, the texture. Is it glossy? Is it matte? Is it, bumpy? Is it smooth? When if you're sitting in your chair, what is the fabric of the chair you're sitting on? Are you wearing a piece of jewelry? What does that feel like? What is the texture of your hair? And all of these things, by really being very attuned to these senses, can help distract you from the anxious thoughts you might be having and bring you back to the moment. Does that make sense?
Right, this idea that you're not in present danger in this moment. You are very safe in this space, but wherever your mind is or whatever's happening for you feels different. So grounding exercises are incredibly effective, and you can do it because there's something everywhere. Or even, let's say I was just touching my bracelet. I can feel there's different textures and shapes. This part's smooth, but this part's rough. And it gives me a sensory information that orients me to space and time. I'm in this moment, in this space, and I am safe in this moment and space. It's a really effective tool. It's also really good for people, I think Amy had said this, to prevent a panic attack, or as they feel it coming on. It is incredibly effective. So we encourage you to try that. And again, this is one of those things like breathing that's so portable. So you can do it anywhere, anytime, as long as you've mastered this sense of what this is, because you're hyper focusing on something else. Okay, so we want to pair this with just this other concept of our thoughts matter, right? Our thoughts are incredibly powerful. So if we think something is going to be disastrous, well, that's a really awful feeling, but it works both ways versus thinking that something's going to be fine. It's going to be perfectly fine. It's not a big deal, but our thoughts matter. And so there's a number of ways to sort of go about this, but what we want to ask you to do is kind of match these strategies that we've worked on for the physical or somatic response and pair it with what's going on in your mind, because one by itself is okay, but the two together are much more effective.
So to talking about thinking, right? We could do a whole seminar, and there are whole seminars just on thoughts and awareness of thoughts and the impact that thoughts have on us. But we are always thinking and have this self-talk that might be running through our minds that we may or may not even be aware of. The self-talk can be positive and encouraging. Sometimes it's negative and discouraging. Sometimes it's more in the neutral area. But what we are hoping to convey to you is that if you find yourself in a moment where you're feeling particularly anxious, you can kind of make yourself aware of the thoughts you're having, of the messages you're giving yourself, and then come up with what we call coping statements, right? Which, as the name implies, help you cope with an anxiety-producing, triggering situation. So it's a way to look at a situation and think a bit differently about it, to look at it from a different perspective. It can be a reminder or an instruction to yourself. It can be kind of a pep talk, or it could just be a different, more kind of reasonable way to approach a situation that's causing you anxiety.
It is not, though. Everything's going to be all right. I mean, you may say that to yourself, but the intention here is to find a more realistic way to look at a situation. And it has to be something you believe to be true. So if you say to yourself, it's going to be fine, maybe it will be, but if you don't really believe that, it's really not effective. So a coping statement, like Amy said, is an instruction or reminder to yourself, something you've come up with when you're not in an anxiety, stress, or distress type of state that you then need to call forward to remind yourself, because in that moment, you're not able to pull it forward. But it is not as simple as everything's going to be fine. We don't know that. Okay, so we put together a couple of examples of what that might sound like. We said general and specific because some are specific to anatomy lab and some are just general. So take one moment at a time. That's actually a really good instruction, or just take it one step at a time where you're reminding yourself to take it slower. And instead of seeing something that's very overwhelming, just focus on a piece of it. This feeling isn't comfortable, but I can handle it. Remember, our goal isn't to say we're going to get rid of anxiety, but we are going to say, okay, let me figure out a way to tolerate this. I don't actually have to like this feeling. Whatever happens, I can handle it. Knowing that, if you believe that to be true, can be very powerful. This is hard, but I can do this. I can do hard things. I can do difficult things. These feelings are not dangerous. And I think that's a really important one. So often when people become anxious, now they're anxious because they know they're anxious and now they're more anxious. Like, oh, I'm anxious. So reminding yourself, like, I'm feeling anxious. I'm not in danger. This is not dangerous. Or there's nothing dangerous here. Or that other thing I said before, you're safe in this space. Right now, in this moment, you are safe.
Focus on the task in front of me, not on my worries. So that helps you, again, stay in the moment, stay focused on what's happening in what you have to accomplish, and be less focused on the anxious thoughts that you might be having. This will pass. Anxiety comes and goes, right? We know this about negative emotions. It can be cyclical. So just reminding yourself that this anxiety isn't going to last forever. Now, specific to challenges that might arise going to the anatomy lab, reminding yourself this person chose to donate their body. I'm not causing them any pain. And this experience will help me help others.
What do you think of this concept? Anybody do something? You don't have to share specifics, but use something like this for yourself? Yeah. The one thing we didn't mention, I want to point out, this is not a negative instruction. Pull it together. Well, what are you complaining? This is not negative self-talk. That's not a coping statement. Okay. It's always really something you believe to be true, something that is useful, helpful, reminder to yourself. And it's really important that it's your words. So these are our words, but how you talk and what resonates with you is really important. It can even be something, I've been through a lot of really difficult things, and I can figure out how to get through this too. Okay, so this idea of creating a plan that we keep talking about. Should I just,
what? Oh,
yeah.
Oh, okay. So when, again, and we've said this before, coming up with a plan when you can anticipate that something's going to happen that might make you anxious, coming up with a plan at a time when you're not anxious is really useful, right? So when and where will you use the techniques that are most helpful for you? You make a plan for what you do before the triggering event or situation or person or thought, what you will do during and what you will do after. And then practice again, and practice during times when you're not feeling anxious. Because you don't want to try something new for the first time when you're in the midst of feeling really anxious. You want to practice it at times when you're feeling, so that you can utilize it more effectively when you are feeling anxious.
Right. And a plan could involve somebody else, like maybe it involves your roommate or your friend where you say, listen, this is a really difficult situation for me. So here's what I really need your help with. I'm going to call you and I need you to say this to me, but we should also practice this before this happens. This is not like stuff that we would naturally do, but it's really effective. And you want to make sure that you do this again when you're not, before you get to that stressful event or trigger, but certainly a plan can involve somebody else that's helping you.
All right, so here's an example of a plan that you could utilize or use as a framework about the anatomy lab dissection. So you could say to yourself, before I go to anatomy lab, I'm going to do some breathing. I'm going to do a guided imagery, maybe at home, so that I enter this experience as calm as I can conceivably be. Then during the time that I'm in the lab, I'm going to use coping statements, remind this is difficult, but I can do difficult things in order to help you navigate your anxiety in that experience. And you can use grounding exercises if you're feeling a little unsteady or a little shaky to help you bring you back into the moment. And then after, you can use any of these things again, and you may need some time on your own to process what happened, or depending on what helps you the most, you may want to get together with friends and socialize. But here's an example of a plan of things that you can do before, during, and after to help you navigate a difficult situation.
Sometimes people forget the after, but remember how exhausting and stressful these experiences are. So if I'm going back to anatomy lab, if that's going to be a really difficult thing, or it is a really difficult thing for you, make sure you have something on the other side that's comforting for you or that you're really looking forward to.
And so now we're revisiting something we talked earlier. We won't spend too much time on this now, about the difference between, your kind of average, normal anxiety and anxiety disorders and times when anxiety may become problematic. And so what we just want you to be aware of in yourself and in others is that if you're having if you're experiencing anxiety that's so intense or so long lasting or so frequent that it interferes with your ability to function the way you're used to, then it might be time for you to reach out and get some added support or some help. So some of the things that you want to be on the lookout for is feeling nervous, anxious, or on edge most of the time. So more of the time than not. Not being able to control the worrying or stop the worrying that you're experiencing, worrying too much about different things, trouble relaxing, feeling restless so much so that it's hard to sit still, becoming easily annoyed or irritable in a way that's out of character for you, feeling afraid as if something awful might happen, or the experience of having ongoing nightmares or really disturbed sleep. So if you're experiencing, or if you find yourself or a roommate experiencing those kinds of symptoms, then it could be really helpful to, see someone in student mental health or some other support system at that time.
Okay. So here's our summary and take-home messages. Right. So anxiety is a normal human reaction. We know it's adaptive. We know it's biological. We know it has a purpose to it. We talked about that. We're not really trying to get rid of it because that's not realistic, nor is that useful, but we are trying to manage it and understand it. And really, I'm asking you to better understand yourself and the situations in which this comes up for you. And then we talked about the breathing exercises, the different kinds of things, and also this idea that learning a new skill takes practice, and really encouraging you to try that. What do you think? Does it seem realistic to you? Okay. So now we'd like to have a little bit of questions, discussion, anything that you want to bring up, and we are not going to record this part.